Namaste everyone. Today we are going to discuss about period of communicability of some disease. So what is the meaning of communicability? Communicability also in the context of SA secondary attack rate, we also consider period of communicability. In the case of diseases, communicability means it transmits from one person to another. So in the case of influenza, 1 to 2 days before to 1 to 2 days after onset of symptom. So DB and DA, first of all must be noted that DB, where DB stands for day before and DA stands for day after. So 1 to 2 day before to 1 to 2 day after onset of symptom. Chickenpox, in the case of chickenpox, 1 to 2 day before to 4 to 5 day after appearance of rash. Appearance of rash. Measles, 4 days before to 5 days after appearance of rash. So in some diseases, after appearance of rash, the communicability will take place, okay, and in the case of some diseases, symptom, on the basis of symptoms, the communicability will occur. So in the case of influenza symptom, chickenpox, measles, rash, mumps, 4 to 6 days before symptoms to 7 days thereafter, rubella, 7 days before symptom to 7 days after appearance of rash. Here also rash, and pertussis, 7 day exposure to weeks after paroxysmal stage. So in the case of pertussis, there are 3 stages: paroxysmal stage, catarrhal stage. So pertussis, in the case of diphtheria, 14 to 28 days after exposure to weeks after paroxysmal stage. Meningococcus until absent nozzle and throat discharge. Why nozzle and throat discharge? Nozzle and throat is the main carriers in the case of meningococcus. So here until absent nozzle and throat discharge, but in the case of diphtheria, but in the case of meningococcus, nozzle and throat discharge absent, then it will transmit or it will communicable to another person. Tuberculosis, as long as not treated, if the treatment will not provided on time, then tuberculosis will transmit to one person to another person, from one infected person to another infected person. One person will transmit to 10 to 15 healthy person. In the case of tuberculosis, tetanus, none. Why none? It will not transmit to another person because tetanus is a dead in host. Man, in case of tetanus, man is a dead in host. So that's why those person will be infected